Hello, everyone. Good afternoon, since it just switched to noon. We are so excited to have you here today for the next webinar in the Human Trafficking Prevention Project's webinar series. I am very excited to be here today with some special guests and my co-presenter, Jessica Emerson, the director of the Human Trafficking Prevention Project, to talk to you a little bit about principles of harm reduction and how we can apply some of those learnings and approaches to anti-trafficking advocacy and client services work. We are very excited to have some guests here from the Baltimore Harm Reduction Coalition. Everyone's on camera right now, so I'll let everyone wave, but then we'll do a quick introduction. So we are going to start with a presentation by our colleagues from the Baltimore Harm Reduction Coalition. And with us right now, we have two members of the coalition, Rajani Gudlavalleti, who is the director of Mobilization, and Harriet Smith, who is the director of education. Owen O'Keefe will be joining us later for the discussion portion. So after that presentation, then we will be moving on to a discussion that looks at how we might be able to integrate harm reduction principles into anti-trafficking client services and advocacy. Before I hand the presentation over to my colleagues, just a few housekeeping notes. We will be monitoring the questions in the chat, so feel free to put comments, impressions, questions in there. I think we're going to let our colleagues get through the presentation, and then we'll turn to those questions in the discussion portion later. And this webinar is being recorded, and we'll send out a link which you'll be able to access on our new HTPP website after the presentation. So with that, I will hand it over and we can jump into the presentation by the Baltimore Harm Reduction Coalition. Thank you so much.
Thanks. Heather, can you hear us okay?
I can hear you great, yes.
Okay, wonderful, wonderful. So as Heather said, I'm Harriet. I use she, her, and hers pronouns. I'm the director of education. And in the office is Rajani Gudlavalleti. She also uses she, her, and hers pronouns and is the director of mobilization. I'll be giving the bulk of the presentation portion, but we're going to have a lot of time for discussion, and you'll get to hear her and Owen and Jessica and Heather a lot more. Just going to lay out a few things so that we can use that for a launching pad for discussion. All right. So just bear with me while I try to advance the slides.
I did give you permission. Hopefully it will work, but if not, I'm happy to take over.
Okay. Well, we might need you after all.
There we go.
Best laid plans, huh?
Yes. Oh, what the coronavirus does with challenging.
Thanks, Rona.
Yeah, tech challenges.
So you're in the right place if you want to learn more about harm reduction or start learning about it. And if you care about people and you want to build a world without oppression, basic flow, as I said, is just going to be sort of a presentation of harm reduction philosophy, practice, and then we'll get into sort of the intersection and application between harm reduction and anti-trafficking work. All right. Intros, you already know everybody by this point because they've been introduced, so we can move on. So I know this is the part I hate as somebody who attends these kinds of sessions. I hate being told to close all my tabs and to focus in, but I also appreciate it while I hate it. So if you wouldn't mind closing those tabs and really focusing in, I think that will allow us to have a much better discussion portion. Feel free to write down your questions. And I'm always interested in folks writing down or at least taking note of their reactions, be they intellectual reactions or emotional. And usually there's a mix that happens for us. So I'd be really interested if you wanted to try that practice as well. You don't have to share it, but it's always interesting as a means of self-exploration. All right. So an intro into harm reduction. We in BHRC like to think of harm reduction in two levels that all work together. So we have this sort of individual level or core of what harm reduction is all about. It's about expanding choices and increasing access, promoting opportunities to assist people in being safer, particularly when engaging in culturally stigmatized and criminalized behaviors, such as drug use and certain types of drug use and certain types of sex, right? A lot of times we talk about harm reduction only at this level, just like we need to help each other. We need to make sure that there are, various tools available, that we need to make sure that people have lube and condoms of various sorts, that we need to make sure that people have syringes and naloxone. We just, we think of these tools and these practices. But there's also this institutional layer, which I thought might be particularly interesting or of interest to this group, which is that harm reduction also aims to shift systems, particularly systems of power, and our broader culture to be safer for individuals and communities. This can look like a lot of things. It can look like making sure those tools are available, right? How many condoms can you carry without you being caught up on any kind of prostitution-related charges, right? That's an institutional layer that can either support the carrying of tools or undermine, practices that might utilize those tools for greater safety and comfort. The same is true for tools to use drugs more safely. Right now in Maryland, you cannot carry things that the police think might be used for drug use, including lighters and syringes, baggies. Like you could kind of interpret from there, but that institutional layer is like, how can we support safety? And then also, how can we understand that society and the systems within it have historically increased harm to people who use drugs or engage in sex work, and used the idea of drug use and sex work to increase harm through oppressive policy and stigmatizing culture. And we'll get more into that it's not just about people who use drugs, but people who are thought of as using drugs, or people who are culturally connected to drug use at any specific time. And the same is true for sex work. And then, yeah, great. So just to differentiate, because we hear so much misunderstanding of what harm reduction is, we wanted to kind of help differentiate between what we're talking about and then what we're not talking about. So a lot of the phrases that we connect to harm reduction are on the left in the slightly larger box. So it's, meeting people where they're at, but not leaving them there, right? So it's not assuming that having sex or doing drugs is bad, but that we might need assistance. And that is going to look really different depending on your day-to-day routine, depending on your access, depending on your comfort, depending on, your past experience with those things and all of that. That it's about avoiding placing judgment on individuals, acknowledging the significance of any positive change. This statement comes from Dan Bigg out of Chicago, who unfortunately passed away a couple years ago. But the idea here is that it's not an all or nothing approach. It's not, you must do, abstinence from sex all the time, every day in order to be the safest, or you're not being, healthy or well. Like that kind of all or nothing approach is not what we're going for. And when we try to create changes for our routines or our, day-to-day habits, it's not all or nothing either. Smoking less cigarettes is better than smoking either sort of, smoking less is better than smoking where you were. And so acknowledging that it's a step, that it's a helpful point on the path towards any positive change you might be seeking in your life. Harm reduction is really about creativity and flexibility, trying to figure out the best ways of meeting each other's needs within an understanding that our systems are not created with our needs in mind. So we have to be creative and flexible. It's not creative and flexible because we love creativity and flexibility, which we do, but it's because we have to be, right? Engaging in radical love. We have colleagues here in Baltimore who constantly remind us that it's really about keeping people in relationship to each other and not allowing the isolation of oppressive systems to be enacted. And it's really about redistributing power, and it's certainly backed by scientific evidence and common sense. So differentiating that from risk reduction, a lot of us use seat belts or helmets as helpful sort of metaphors or parallels, but seatbelts and helmets are not so culturally stigmatized. They're certainly not criminalized in the same way. Seatbelts and helmets aren't used to lock up whole generations of people in the United States. So they're really not appropriate parallels in many ways, even if it kind of helps us to think about what it might be like to have a tool to help reduce risk. It's not about giving directives or instructions. It's certainly not one size fits all. Harm reduction teaches us that oppressive or coercive policies are harmful, and to look out for that. It doesn't mean you can't have expectations or rules or boundaries, but it means that coercion doesn't lead to better outcomes for anyone. And it's important to remember, like, harm reduction is difficult. It's not sunshine and rainbows all the time. Sometimes when I say it's about radical love, people are like, oh, then it's just like fun and beautiful. I'm like, no, it's messy and hard. And that's what radical love is. So for today's discussion, what we've done is taken 3 of the principles as they're outlined by the National Harm Reduction Coalition, and are just going to look at how they might apply. There are 8 principles outlined by the National Harm Reduction Coalition, some of which really overlay well with what we do and talk about here at BHRC, and some we might change more, but they're pretty, I think they're pretty well agreed upon by most harm reduction organizations in the United States and across the world. So we wanted to take these 3 and kind of show how it might apply to the anti-trafficking work that many of you are involved in. So these are the 3 that we're going to use, and then there's like, yeah, a few slides on each of them. So we can go to the next one, which will lay out the 4th principle. So the 4th principle calls for the non-judgmental, non-coercive provision of services. I should say that the National Harm Reduction Coalition only focuses on drugs and drug use, whereas many harm reduction organizations across the world focus on drug use and sex work because they are so similarly criminalized, even though there's a lot of differences, and because individuals cross over between those 2 categories so readily. So number 4 calls for the non-judgmental and non-coercive provision of services and resources to people who use drugs and the communities in which they live in order to assist them in reducing harm. So non-judgmental, accurate information, radical love, like finding ways of getting resources, information being one of them, tools being another, avenues for participation, and all of the kinds of things that we could think of as services. So the way that I was thinking this applies here is that our systems over time, and since the founding of these sort of structures, these systems, drive demand for kidnapped and coerced laborers. And harm reduction reminds us, so this is harm reduction sort of at that institutional level, like, oh, okay, our systems demand this, right? Or certainly reward coercion in labor. And then harm reduction reminds us that individual behavior doesn't occur in a vacuum, right? and that laws limit or enhance our ability to experience and to engage in non-judgmental services, and that it's not appropriate to draw a comparison between drug prohibition and prohibition of harmful policies. So this one sort of crosses over those two layers of the individual and the institutional. And here, you know, with number 4, I know some of you might be interested in like practical tips for non-judgmental and non-coercive services, which there are, you know, lots of information about how to do that and some supports for how to do that, because it's not always easy. What I often tell people is notice your stuck points. So notice the times when you want to just tell someone what to do, and why are those times coming up? What are they coming up around? Are there certain things that kind of get you to be more directive? And how is it appropriate? Maybe it's appropriate to be directive. Sometimes it is. There's an emergency and you need someone to move away from something, be directive. But when is it holding you up from engaging in services that could really help to shift power to the individual? Particularly knowing that our systems are set up to take power away from that individual when we're talking about people who are associated with drug use or sex work, and certainly people who have had their power taken away through coercion in their work, their labor. So the 5th principle is one that I dub nothing about us without us. It says that it ensures that people who use drugs, and we would add and engage in sex work, and those with a history of drug use are routinely have a real voice in the creation of programs and policies designed to serve them. And so this really is a sentiment that comes from the US disability rights movement. I'm sure a lot of you will recognize this sentiment. And yeah, and I sum it up in this phrase from the disability rights movement, often nothing about us without us. And it really says that policies, but also, you know, the sort of the setting up of services and the programs meant to assist people who are targeted by drug prohibition or sex work prohibition. So policies relating to all of that are routinely made without the inclusion of a broad array of voices. And in fact, we know of a lot of recent examples and examples throughout history that policies are often made in these arenas despite organized efforts of people directly impacted telling policymakers that the legislation will cause them harm. We certainly see this with Sesta Fosta and others, right, where we're saying this won't help. This will actually cause more harm, and there's an active dismissal of that voice. And one thing that this is really reminding me of is that it's politically palatable to sort of engage in this save the victims of drug abuse. I'm using their terms. And I've seen this in anti-trafficking work too, but it's politically risky to undermine the systems that cause harm. So it's palatable to say like, oh, poor you, we will save you from the throes of fill in the blank. But we won't look larger than that. We won't look, why is there this harm that we see? What do you need to be saved from? Could we do something at a larger level or at a deeper level? And there's that would be really politically risky to look larger or to look deeper. And it certainly is often politically risky to listen to a broad array of people impacted. Usually there's the one person or the one sort of message. And yeah, we move so fast and we have a very curated sense of who gets to speak about impacts of legislation. All right, and then number 7 is the last principle of harm reduction that will sort of draw some comparisons or at least use as a tool to look at both harm reduction and anti-trafficking work. So number 7 is harm reduction recognizes the realities of poverty, classism, racism, social isolation, past trauma, sex-based discrimination, not sure why they didn't write sexism there, and other social inequalities, and they affect both people's vulnerability and capacity for effectively dealing with harm. So in this, my sum up of this one is that the context is everything, which brings us to what Heather mentioned that we're going to get into in the panel in a few, is that if context is everything, then we have to look at our systems. And again, sort of repeating that individual behavior doesn't occur in a vacuum. And that there's no easy villain when we do that. When we zoom out, we have to look at ourselves a lot more. We have to look at how we participate a lot more. And that is a really hard thing to do. We really want there to be an easy one person to take down and the whole thing will crumble. And we certainly see this in drug prohibition laws with kingpins, right? This term kingpin, we want to get the person at the top. We don't want to get the poor folks at the bottom, you know, in this sort of language like this. We want to get to the, you know, the boss or the kingpin. And it doesn't work that way. There's, you know, if we really wanted to look at how to provide for people that doesn't drive pretty common behavior underground, then we'd have to look larger than just, oh, where's the bad guy? Where's the kingpin? I'm not saying people are always great, but I just that we need to look at the systems and structures too. And that if we look at the systems and structures, we start to see the ways that we are implicated. And it makes it harder to identify the one person who, if we just remove them, the whole bad thing will crumble. So I think I have another slide, and another element of this context piece. I really appreciated the principle that the National Harm Reduction Coalition lays out in number 7, is that not only does context matter, but context, the narrowing of context, particularly by criminalization. So narrowing of context by saying, well, this person is just a criminal or this is just illegal, and not looking at the larger picture makes us really poor analyzers. So some of the things I was trying to sum up, like that can mean a lot, that we are poor analyzers. Some of the easiest ways that we become poor analyzers is that we forget that not everything that is illegal is wrong, and the reverse, right? And that safety doesn't result from criminalization. So, and I think in the case of sex work, and we'll get into this a little bit more, it makes us poor analyzers because we are unable to see the connections between certain types of labor. We want to set sex work separately. And we're not able to see that that might be similar to the trafficking that's happening for migrant farm workers. It might be similar to the trafficking that's happening in other sectors, because criminalization, well, sex work is a crime, you know, picking potatoes is not. And so it makes it harder for us to find those helpful connections. I do want to say, though, that anti-drug laws are distinct from anti-trafficking laws because drugs and drug use is not wrong. I know that can be, you can jot down your feelings on that one, but certainly coercion and kidnapping and forced labor is wrong, obviously. So I'm not drawing a complete parallel, like they're exactly the same. We just need to treat them the same. They're not, but it makes it, you know, this criminalization element makes it hard for us to see how they are not like each other. And it makes it hard for us to see the ways in which drug selling and trafficking might intersect with sex work and sex trafficking, and then other types of labor trafficking as well. It complicates it. All right, another context, I love context. So another context element is that we can't leave out this sort of like cultural water that we're swimming in that says the whiter the face, the whiter the face of the person that we're imagining, sort of the more supposed compassion we can muster. So we've seen this with the sort of attention to sex trafficking, and we've certainly seen this to the attention paid to people who are using drugs with what is coined as the opioid epidemic, even though it's an overdose epidemic, but we have a white person in mind, and that lets us move from monster to victim, which is not a great move all the time. I'm not arguing that it is, but it certainly allows us to muster more compassion. But we still need a villain. We're not willing to let go and look at something larger than the individual bad actors. We still want one bad actor that we could take down and everything would be solved. So a little bit, this is like, a little bit about like Maryland context. I just wanted to make sure that you were familiar with some of these groups. Some of the groups got cut off, I think, by accident, so I'll just name them verbally. So these are groups that are involved in harm reduction, advocacy, and service provision in Maryland. If you were to dive into kind of like Maryland harm reduction world, you would encounter these groups. Behavioral Health Systems Baltimore, Be More Power, which works very closely and is connected to Behavioral Health Systems Baltimore, Power Inside, Communities United. There are some researchers at Johns Hopkins School of Public Health that are involved in a lot of advocacy and service provision. There's also Baltimore Safe Haven. I think that just got cut off by accident. And SWAP is like a national presence, but they also have a chapter here in Baltimore and in Maryland. And then I've highlighted in the box groups that we are either representing here today or intimately involved in. And so that's where we work, BHRC. And then also two groups of different individuals and organizations. One is the Bridges Coalition for OPS, and the other is the Maryland Harm Reduction Action Network. Both work statewide, one more specifically on overdose prevention sites, and making sure that they are legally authorized here in the state so that we can bring above ground the sort of informal networks of people who will watch over each other while using drugs. And the other is more broad, the Maryland Harm Reduction Action Network, and really focusing on what does harm reduction have to say around police brutality, reparations, what kind of laws do we need next in Maryland, relating to harm reduction, doing a lot of look at our movement, and some sort of localized action planning. St. Mary's is dealing with different stuff than Hagerstown, and they should share with each other and support each other, and there might be some locally specific elements to the work that they're going to be doing. Okay, so I didn't introduce what BHRC is because I just wanted to dive right in and not sort of flip around the like intro stuff so that I could capture your attention. But I do want to share a little bit about what BHRC does. So this is our mission statement. I'll let you read it on your own, but we do focus in on these terms targeted by the war on drugs and anti-sex worker policies, in recognition that almost all human adults utilize drugs or anything that could be classified as a drug at some point. Not everyone is targeted by the policies that make up the war on drugs, right? And sometimes people who are targeted don't ever really use drugs. So there's this need to understand that layer of the institutional and how it impacts the health, dignity, and safety of our neighbors and ourselves. And the same is true for anti-sex worker policies. Not everyone who is targeted by those policies actually engage in sex work. I'm sure many of you have heard the term like walking while trans, right? It really doesn't matter if you're engaging in sex work, if someone, meaning like someone with a significant amount of power and ability to be violent, thinks you are, then you are being targeted by those policies. If you're carrying around a number of condoms and you get sort of harassed or asked about it, or certainly if you get a fine or a ticket or arrested, those are anti-sex worker policies that impact people regardless of whether or not they're engaged in sex work. And then, of course, it's important to mention and to ground ourselves in the fact that this advocacy for harm reduction is a part of a broader movement for social justice. We do this through three sort of buckets: services, providing those like tools and information directly, so that we can, stay in this together, we can be well and stay alive. Education, so really sharing what we learn and know, and then taking a lot of time to learn and listen, and make sure that we have the sort of the capacity to shift that broader cultural messaging, and to undo it in ourselves, and to have some access to accurate information when it's so often pushed to the side in place of really stigmatized political information. And then the other bucket is mobilization. So getting folks involved with that institutional layer is a lot of what this mobilization is about. We really want to shift that institutional layer, knowing that it will have a huge impact on the individual level. And so we can't do that without getting lots of voices and lots of people involved. And so this bucket is all about getting involved: when, where, how, what do you need to feel confident in that, and really linking that between all of the other buckets, and all of them work in tandem. Okay, so I went through that super fast because I wanted to have a lot of time for discussion. I might have gone through some of those things too fast, so we would love to take questions that are like clarifying questions first, and then get to like the super juicy, like difference of opinion kinds of questions after the clarifying ones, if there are any. I have not looked in the chat.
Heather, you're muted.
Thank you. Now we're back. Thank you so much. That was an amazing presentation, and I think it gave all of us so much to think about as we look at the services we provide and the advocacy we're trying to do. I have been keeping an eye on some of the questions and comments that have been submitted via GoToWebinar. Thanks to everyone for participating. I'm going to take a minute to go through those, but I think I will let Jessica kick off a discussion, and then we can turn to some of the questions submitted by the audience.
Sure. BHRC, as a larger group, thank you so much for this presentation and for starting off our discussion in a way that I think is going to be incredibly valuable. One of the things, before I ask a discussion question, one of the things that stuck out in your presentation was the term, the whiter the face, the more compassion we have. And the notion that we have to look inward at our movement before we make any movement outward. And, anyone who's talked with me about this, has heard me rant about this before, so feel free to tune me out if you've heard this before. But I mean, we really need to, if you are working in the anti-trafficking field, and you don't know the history of the anti-trafficking field, you're starting at a disadvantage. And the history of the anti-trafficking field very much is rooted in the white face that needs rescuing. And I mean that very literally. The white slave trade is what was kind of utilized as the reason for the modern anti-trafficking movement, or the need for the modern anti-trafficking movement. It is what started the movement towards modern anti-trafficking laws, most specifically the Mann Act, which was essentially an anti-miscegenation law designed to make sure that the law could prosecute Black men for having sex with white females. And that in and of itself became an anti-trafficking law that ironically, or not ironically, I should say, a lot of Black survivors are charged under. So just kind of understanding that, that history, and understanding that the movement itself was built upon the whiter the face, the more compassion we must have. So I just want to thank you for naming that and for reminding us as an anti-trafficking community that that's something that we need to acknowledge and feel before we're able to, again, do the work outward. So the first thing I wanted to actually, let me pause. Heather, do we?
Can I say?
I was tasked with slowing us down and getting some of the chat questions.
Can you all hear me? Okay.
Yes.
I just wanted to say something to that point, Jess. A couple things. So again, I'm Rajani, Director of Mobilization at BHRC. We have our masks on, practicing one form of harm reduction right now. So just something to also think about is questions around, first of all, white women, right? When we talk about white women and the innocence and purity of white women, that the concept around innocence and purity of white women has been a reason to validate drug prohibition laws for 145 years in the United States, since the very first ones in San Francisco to outlaw opium dens, protecting, and I'm doing a lot of quotes, protecting white women from Chinese immigrants who were mostly men. That was actually in documentation a reason, right? In propaganda a reason. And so when we think about that, that is not so far from, because it was almost unsaid of like, and also said, because you know that road that people will go down, then those women will become sex workers and will be put on the street. Like, it's almost an unsaid but also very connected issue, right? So really connecting the war on drugs and the war against sex work and sex workers together. I mean, it's always been tied together around, and this concept of white women's purity is a part of that. And I also just want to uplift the concept of that comes up a lot is white slavery. It's always like the default is that slavery is against Black people, right? So the word slavery is for Black folks, but white slavery isn't. Like, you know, why do we say white slavery? And and I think I say that because that is very, very often a phrasing used for the in trafficking concept.
Well, right? And it's not, and again, it's not just phrasing, it's the underpinnings of the actual movement.
Right.
And more severe than that.
Right, the racialized aspects of that, the implicit bias brought in with slavery is okay, right? Like slavery of Black and brown people, but white slavery, now we have to do something, right?
Now we have to have action.
I'm pushing some, you know, I see 80 people in here who might be feeling feelings. It's okay. Hi, again, I'm Rajani, but I just wanted to say those things because that came up.
Yeah, but if we don't know that history, and if we don't challenge or face that history, then we are not, again, to not co-opt another kind of slogan, is we're doomed to repeat those same patterns if we're not kind of checking our understanding of the movement at the door. So Heather, any questions that might kind of go into this, or should I keep going?
There's a pretty long list of questions that have been submitted, but I'll just share some of the comments from some of our participants first, just noting this was during the presentation, just drawing some parallels to how a lot of these ideas and themes cross over into individuals that are doing domestic violence work. Just noting the different approaches to the crack epidemic as opposed to the opioid epidemic, and tying in again some of the ideas that have been discussed. We have a lot of questions regarding getting further information, and I would direct people to your website to learn more, and maybe we'll be able to send out some additional resources when we circle back around after the webinar. But a lot of people are looking for that concrete guidance. You know, how can we get more information about harm reduction? How can you know, we get some more information about how supervisors and therapists could maybe help their direct care staff understand harm reduction.
That's my favorite thing to talk about. So
hey,
great.
Link up. Yeah.
Wonderful. I don't know if you want to say a few words on that quickly before we go on to some of Jess's questions.
Yeah, could you? Because that was actually going to kind of fold into what I was going to say. It's what kind of, what does a counseling program, what does a shelter program, what does a peer support program look like if we integrate some of these principles of harm reduction? That was going to be part of my first question. So go for it.
Yeah. So I mean, yeah. Okay. Whew, I'm just very excited because this definitely challenges a lot of the ways I thought about providing peer work when I was a peer worker, and providing supervision for peer workers when I was a supervisor. So I think what a lot of service movements, so I'm thinking of anti-trafficking as like a sort of a service movement in this moment. I know that's not the full picture. And as domestic violence sort of service movement, I know that, again, not the full picture. But a lot of what they tell us is that you have to understand yourself as a victim or you can't move forward. You have to understand that you have been, you are a sort of victim of these individuals. And that's not going to work for everyone. You know, like relationships are messy. That just, you know, there's a whole cadre of like adult children whose therapists say they were abused and they're like, it's not working for me to think of myself that way. And so there's sort of like this victimhood stance, and even survivor just becomes a different word for the same kind of phenomenon where you have to understand yourself as someone without agency, and then the healing can begin. It's like, that's not going to work for everyone, you know, and maybe it's not the best way, even if it does work, to understand yourself as a victim. The same happens in a lot of abstinence-based drug sort of recovery spaces. You have to understand yourself as powerless before you can really start a path towards wellness. And I think harm reduction has us like throw that and like really upset it and say like, you're a person with a messy ass life just like me and everyone else, and like how can we like what next for your messiness, you know, and really let it be guided by the internal reflection that somebody can do for themselves, and like building up the tools for internal reflection. There's a really great like a practical thing that harm reduction is often used called decisional balancing. So if you like, you know, Google that real quick, you'll often see, I really like it in its chart form. So a lot of the way that we ask people to reflect on their own behaviors is what's good about the behavior, what's bad about that behavior, right? Sort of a pro-con list. This adds like another pro-con to it to make 4 questions. What's good about the behavior? What's bad about the behavior? What's bad about stopping? What's good about stopping? You know, like really like opening it up to more questioning so that somebody knows what, I mean, for me, it has helped, somebody knows what they're giving up when they change a behavior. It's not just, I'm gonna quit smoking and my lungs are gonna be so much better. It's like, you're gonna give up maybe a whole bunch of social time. You're gonna give up, you know, something that you used to do to take breaks from work, and now you might overwork. Like really thinking through the positive aspects of a behavior you now identify as negative, right? And letting that speak. And often I think clinicians are too afraid to let that speak, that we're just like, oh no, but you're so close to making the decision I want you to make. So like, let's not acknowledge the awesome things about the thing I want you to stop doing, you know? And I think harm reduction really reminds us to do all of that.
Harriet, I loved how you said that people are messy, relationships are messy, and our connection with things that are allegedly bad for us are messy. You know, I come from the perspective where I'm teaching, or I'm attempting to teach law students how to be lawyers. And one of the things that they struggle with the most is, you know, just for instance, talking about the good in a client's drug use, and talking about the good in a client's trafficking situation. You know what I mean? And that understanding that this I don't know if it's the right phrase, but this sum zero philosophy where everything about something must be bad if the law says it's bad, leaves our clients in a position where they are going to struggle with kind of the dimensions of this little box that we're putting them in. I mean, even when we talk about, you know, within the clinic, when we talk about trafficking, and we need to assess whether someone's been the victim of trafficking in order to know what their legal options are, right? Like that is something that's concrete. and kind of helping new attorneys and volunteer attorneys understand that you can have an experience that meets the legal definition of human trafficking. But as the service provider, you don't have to design the experience for them, if that makes sense.
It does.
And I'm hearing a lot of parallels in what you're talking about in terms of harm reduction principles there.
Yeah, definitely. Defining someone else's experience for them is just no, right? That is coercion.
Yep.
And we have to work to get coercion out of our anti-coercion services. Yeah.
So let's stay there a little bit, Heather, if that's okay.
Sure. I just wanted to throw in a few more comments from the audience as we're talking. Some people are commenting, just noting, going back to the discussion of race and the intersections of this protecting, vulnerable people that, are the vulnerable whiteness of certain people. One of the participants was commenting that, you just need to drive down the highway and see some of the flyers that are out there asking people in rest stops to report human trafficking. And often it's just pictures of white women that are on the flyers, really having kind of a narrow focus of who can be, helped in this context or might be facing challenges in this context. There was another comment, someone was noting that they face a fair amount of resistance from staff at their organization when they're trying to do things like distribute condoms, distribute bus passes, burner phones to the individuals that they serve, which include survivors of human trafficking. So I don't know if there's any strategies, as we could incorporate in our discussion for trying to help with those situations.
I'd love to hear BHRC's perspective on that, because I think that that's something that the anti-trafficking movement struggles with as a whole. I mean, my comments are going to be just kind of global in nature, but that is one of the things that the trafficking movement struggles with, is that, again, that the exit only is the only strategy for healing and for perspective and for recovery. And that's just not realistic, because people's lives are just not like that. So I would love to hear some harm reduction principles applied to programs that are struggling with some of those issues.
Sure. Yeah. So it makes me think a lot about, we were talking a lot about the concept of autonomy in preparing for this, and sort of thinking about what are the connections between harm reduction and the anti-trafficking movement, right? And when we think about autonomy, I think the best example of that comes to my mind is autonomy is a major tenet of harm reduction. You ask any harm reduction program across the whole world, autonomy tends to be one, but it's like, what does that word mean? We don't really use it every day. And so the way I think about it is around dignity and respect. And if for data folks out there, if you were to look at any studies that are done on harm reduction programs, again, globally around the world, thousands of programs, one of the number one things that comes out from participant surveys or what participants say they love about the program is that they feel respected, that is somebody who is welcoming them, looking them in the eye, right? Folks find that to be, that's one of the first things we hear. I hear is like around a welcoming face in this world of folks not wanting to even look at somebody, not wanting to touch them on their hand. And also just listening, right? This non-judgmental, hey, how's it going? What's up? And then to see an array of options like condoms, just to see it at the welcome desk, at a program, we're like, oh, yeah. Right? And people will giggle all the time. I've had grown folks giggle like, oh, okay, I'm gonna take one of these. I'm like, take all that you need. I can hide if you need, we like make a joke out of it because for some reason sex is always like, we giggle, okay, sure. But the person now has condoms. And I'm like, great, whatever. And we have a rapport building, right? Because then you see that person the next week and they're like, oh, I just need to get some more stuff. And I'm like, okay, oh, this is just for my friend. Or, I don't care who it's for. But then you see that person more and more because they know I'm not saying, well, if you're going to use this, here are now all of the ways I want you to practice everything else and be forceful, right? I'm not going to be forceful. I'm not going to tell the person how to have sex unless they ask, right? Unless they have questions on what is lube and why do I need this? Unless they don't pick up the lube and I'm like, you know what, maybe you want to take this. Now let's open a conversation about condoms, about lube. These tools are definitely helpful for our everyday lives, right? And they are conversation openers.
Mm-hmm.
And again, it's conversations in a non-judgmental, welcoming environment that we're respecting someone's autonomy. We're saying, you have this now, do with it as you please. We hope that you are safe as you are existing in the world. And maybe for some of us, we're like, okay, that's nice, but that is not a default experience for the vast majority of humans in this world, and especially women, and especially girls, if you think about that. So that's where I think autonomy is really important to me and to harm reduction work. And when we think about just the aspect of having condoms around, yeah.
I love that. Like, yeah, not just about the item, but it's about the process of you get to have around the item. Like, how do you like your tea? Right? It's not just I want you to drink tea and have it. It's like, oh, I get to respect that we get to learn about each other, and I get to respect that you have a choice with what kind of tea you want, and like you also might have condom preferences. Like, it's about knowing that somebody else has preferences and they're worthwhile. And using that as an opportunity to give trust and show trust for each other and respect for each other. The person who is wanting to change their workplace, just want to say, like, you got this. It's gonna be okay. And try to find someone on the outside that you can just complain to, who will hold you up, because it is very like crazy making. I say that as a crazy person, but it is crazy making to be in a world where you're like, do I have to fight over this? Like, do I have to fight this? Right. And it can just kind of warp your sense of reality. So having somebody on the outside who's like, that is not okay. Like, oh, okay, whew, I thought it was just me. So having that person just reality check with you might be helpful.
I think that's why we get along. You're a crazy maker, as you just described yourself. I think something about our all of these panelist relationships just dawned on me, but that's neither here nor there. So just kind of to go back to that term autonomy, and something that you said during the presentation was shifting and sharing power. Right? Couple of the ways that I see it, and again, this is a 101, so unfortunately we're not going to get into kind of these core concepts, but if there's interest, we can, double back on this in a future webinar. But I'm thinking about, programs that don't have those materials, those materials available and aren't having those discussions. Anti-trafficking programs where exiting the sex trade only is the only way forward. I also think one of the chief ways that anti-trafficking programs can honor someone's autonomy is respecting the range of experiences in the sex trade. And this is something that, that we talk about, Heather and I talk about when we train. When I talk about the ways that people get involved in the sex trade, we talk about choice, that people choose sex work, they do. That people get involved in sex work out of circumstances in their lives. And then there are experiences, obviously, where we're talking about manipulation and coercion and force, and that is trafficking. But again, just speaking globally, the anti-trafficking movement works very hard in certain instances to define people's experience and say that, sex work or trading sex is inherently harmful, inherently, what's the word I'm looking for? Just inherently problematic and inherently painful for people. And when we decide what people's experiences are, we really are reproducing those systems of coercion and oppression that in most instances have led someone into those very situations. And so I think that, one of the things that anti-trafficking folks who are listening, who run anti-trafficking programs or who work with anti-trafficking programs, is really to check those assumptions and to consider what kind of circumstances you're reproducing when you decide that somebody's experience in the sex trade is altogether wrong or altogether harmful. And that very much seems to fall in line with harm reduction principles.
And I think, Jessica, as attorneys, we also deeply struggle with this. And I'm sure there are a number of, volunteer attorneys from MVLS and hopefully others that are interested in this work on the call. And we always have this desire to categorize and to make sure people are fitting certain definitions, and sometimes placing them within those definitions and taking away their ability to name themselves. It really resonated with me, Harriet, when you were saying, what are your stuck points? And I think that's
Yes, I
something
wrote that down
all,
too.
all
stuck
of the
points.
advocates and for me as an attorney, we need to think about as we're explaining options, discussing strategy, whether we're working with somebody on a legal case or a safety plan or whatever it is that we're working with them on.
So another point that I heard from you throughout the presentation was the importance of language, right? And phrasing things in a way that's empowering, and phrasing things in a way that, again, don't make those judgments about people. And one of the things I think that the anti-trafficking world tends to struggle with is language around things like rescue and saving people. That's built into the foundation, unfortunately, of a lot of anti-trafficking organization and anti-trafficking work, that savior mentality, that savior complex. If we want to, and again, I don't mean to do this, but if we want to at least kind of try to highlight how harm reduction is used with people who use drugs, do you find yourself dealing with that same challenge around savior complexes, and how does harm reduction handle it or address it?
I want to talk about this for 17 hours, which I know I can't, but it is really hard, right? So the first thing I'll say is it's a tenet of harm reduction, and like a mantra for mine is radical love. And we say radical love, and people are like, oh, that's cute. It's like the 60s, hippy dippy. No, it's like, it's really hard. It's really hard. It's actually putting your own stuff aside sometimes to remember that love is also seeing the person in front of you for the wholeness that they are, and working on my stuff later. Like, why do I feel the need to save this woman? Why do I feel the need to do this? It's not about this person as much as it's about something within me that makes me feel like I need to save somebody. And I'm saying that as someone who has gone through that a lot in my life, right? And I'm like, oh, this is some trauma, some dad stuff. Oh, okay, here's some stuff I got to go work on. Let me go find my therapist, right? That's the best thing I can do for the savior complex thing. Because honestly, a lot of us, I would say really anybody raised in the United States is ingrained with some sort of savior complex. We can talk about that for that 17 hours that I'll bookmark somewhere. But with all that said,
that's going to be part 2,
yeah,
Rajani.
Yeah. Stay tuned. I have lots to say. But with all that said, and I say that really, really compassionately to the 80-something people out there, as I know we're all facing it. You wouldn't be here if you weren't. And
it's true.
Another part of being raised in this country, in this environment, is that we have been ingrained with a culture and a mindset that is relying on policing and incarceration. We are absolutely ingrained with that. The concept of defund the police, the reason why those two words, defund the police, gets people in arms is because there's many reasons, but one of them is it's really hard to imagine otherwise, right? It's really hard to imagine otherwise. So I bring those things up to say what we want is to ensure that there are options in the system, right? This isn't about forcing somebody to do one thing, or about saying, okay, here's all the options you have, now let's, sometimes it's hard to choose what you want to do. And a lot of times, especially the people we're working with are also ingrained with the, you know what, I just need to call the cops, or, I'm just going to go to specialty court, right? So many people we've interacted with have said, if it wasn't for getting arrested, I wouldn't have gotten treatment. And that's in the drug policy work that we do in the working with folks who use drugs. It's like, well, if I didn't go to jail, I wouldn't have gotten treatment. And for a lot of people, when they say that, that is a good thing for them, right? They're saying that as a positive thing. And I'm like, okay. And for people moving forward, what if they didn't have to go to jail, right? What if It's somebody who's saying, oh, you know what, maybe treatment's an option for me. And they get to walk in somewhere any time of day or night and talk to somebody there who also is not forcing them to stay in that treatment place, right? And then they get to learn more about, maybe I can actually just go to this harm reduction program every other day, get syringe services, whatever. You know, it's really walking people through that journey of realizing that they don't necessarily need to rely on these systems that we have been trained to rely on. Courts, policing, police as the first point of contact. Police don't need to be the first point of contact. Courts don't need to be the only way to get a referral to some place, right? So I feel like I'm going all over the place, but I hope that those examples are helping folks to understand this savior complex thing comes from really trying to have a goal in mind for someone. So in our work with people who use drugs, it's like, we got to get people into treatment. I hear that from people who are in recovery, right? Who have dealt with, who have gone to hell and back, as people would say, and are here now doing this work for harm reduction, people I trust and respect so deeply. And then it's like, ooh, so your goal for everyone you're going to interact with out there giving naloxone is that you want to get them into treatment. Your expectations are high, which will disappoint you. And it does, and it hurts, and not realistic, and not what people want, right? And so it's removing the goals we have for others. And that's what I think of with the drug, with working with people who use drugs. And so treatment tends to be the one, recovery and treatment. And when it comes to sex work, it's getting off the streets, or it's getting out of sex work, right? Getting out, the getting out thing, getting out of the trade, getting out of this. And it's like, it's not black and white like that.
And those are very much our judgments as
Yeah.
service providers, rather than perhaps the judgment of our clients. And you actually just kind of moved me into my next question, that actually talking about relying on policing and things of that nature. Just before we get into that, there's an article that I tend to always push in these discussions around the savior complex, and just want to make sure that folks are aware of it. Again, anyone who's heard me have this discussion has heard this before, but there's a great article called Take Off the Cape: Why Using the Word Rescue is Harmful to Anti-Trafficking Efforts. And it's by Becky Owens-Bullard. And she writes, when you say that you rescued someone, that statement is about empowering and aggrandizing yourself while disempowering the person you think you rescued. This is because, quote, rescuing creates an uneven power dynamic where the rescuer, read hero, has all of the power in the relationship, and the rescuee, read helpless victim, has no agency or role in the exit of his or her abusive situation. Well, not everyone using the word rescue is purposely trying to pump up their own egos and disempower victims. They're certainly using the term without thinking of its true meaning and impact. And just kind of, again, for anti-trafficking folks, it's definitely a good primer to kind of start thinking through these concepts in your own life and your own work. And one of the things that I've learned in the the anti-racism work I've done is that if I step on your foot, I might not have meant to, but it still hurts. And so I have to apologize and consider that impact. And that just kind of brings me back to that. So that's just something that folks can take a look at, anti-trafficking folks can take a look at if they want to. But talking about or returning back to thinking through the systems that we rely on in the work that we do. You mentioned in your presentation, Harriet, that there are no easy villains in this work, and that so resonated with me. I think that this is something that the human trafficking or the anti-trafficking world struggles with in terms of the inability to separate the illegal act of an individual from the oppressive systems that either fuel that act or compound that harm once that act has been committed. One of the things I'm thinking about is commonly end demand policies targeting buyers, right? So the belief that if we just target the demand for sex and we stop that by getting rid of buyers, we will end the demand for sex. Now, I have a challenge with that because I believe that that allows us to just not think through the root causes of trafficking in and of itself. But in terms of your comments, I think that people necessarily in the anti-trafficking movement don't think about the fact that any end demand policy, for instance, targeting buyers, will overwhelmingly be enforced against Black and brown men who are already the subject of extensive state-based oppression. So, you know, for me, obviously, a person's illegal actions should not be excused. It feels like the anti-trafficking world, with its focus on securing convictions, heightening punishments, training law enforcement, getting victims to cooperate in criminal cases, it allows us as a community or as a movement to, again, escape doing the work of dismantling oppressive systems, but it also forces us to rely on systems that can be oppressive to the very people that we are hoping to assist and hoping to help. So I definitely took that. I told Heather I was going to take one moment to go on my soapbox. So that was.
Well, on that note, so many soapboxes here. And I did not acknowledge our wonderful, wonderful colleague, Owen O'Keefe, who has been sitting here patiently. And I'm like, Owen, I'm going to turn to you in a second. Let me just go off for like 6 minutes. And I'm so sorry, Owen. So I think Owen actually could speak really well to this. I'll name, and Harriet as well. One thing I will name, which was not reported, but we recently at BHRC had an educational event around drug sellers and how drug sellers are people too. And it was one of our most widely popular events. These are monthly events we have, usually about 15, 20 people. There were like 200 people registered for this. 70 or so people showed up. I mean, it is, for me, a sign that people are interested to tear apart this really complicated conversation. And so Owen and Harriet were part of planning for that. So I'm going to turn it to Owen to be able to share, or, you know, anything you'd want to say, but that's something that is coming to me.
Yes. So react to my soapbox statement.
Cool. Hey, everyone. Thanks so much for introducing me. Sorry, I was just kind of silently creeping on the webinar for a while. You all just had to watch my face. Yeah, I'm really happy, though, to chime in specifically on this. Like you said, Jess, we really try to tackle demand in a lot of behaviors that we don't like, such as drug selling, and when it comes to sex trade. And we go after buyers and sellers hard when it comes to those things. And typically they impact Black and brown people at much greater rates, without ever considering really like what the actual harm is that we're trying to stop. With sex trafficking and like sex work policies, I'm constantly saddened as like a white man by like realizing that what we're trying to stop is violence from men, right, towards primarily like women, from being trafficked into labor, or from being abused in other situations, whether they're doing sex work by choice, I'm having a bad date, and how much work we go to create laws that don't directly acknowledge that it is men not taking responsibility for continuing to act in this way. And so we heavily stigmatize the men who are easy to blame, who are buying on the street, knowing full well that there are people who are high up in power who participate in the sex trade really frequently, that this is probably somewhat intentional.
The highest up in power.
Yeah, and it's somewhat intentional that we're not actually driving at that root cause, and having those conversations that could create change, and instead scapegoating to people who, because of stigma and racism, are easy to point the finger at and blame, which is just unacceptable. And so just really trying to think through that. I think when it comes to, yeah, this like moralistic idea of like we really need to stop people from selling sex. It's like we really need to think about conversations with men, and those are not happening through these like really intense policies and locking people up and putting them in jail. Those conversations are not happening at all. So Harriet, if you want to touch more a little bit, those are my 2 cents.
Yeah, I totally agree. I wrote down harm reduction helps us to think about where the harm comes from, right? The harm of taking a drug, the harm is really that you might not know what's in it. The harm is really that you don't have a safe place to use it. The harm is really that you can get locked up even if you think about it. Like the harm is really that whole generations and whole communities have been incarcerated or are under some kind of state coercive supervision, it's called, or surveillance. Like that's the real harm. That's the more harmful harm, right? You know, if we had places where I could take my drugs and have people like watch out for me, that'd be great. What's the harm in that? Right? But I don't have places where I can know what's in my drugs that I'm buying. I'm buying from somebody who's not constantly under threat of arrest. You know, all of that doesn't get to happen. And so we have to, unfortunately, for ourselves, because we're not always the bravest people we wish we were, unfortunately, when we ask for the real villain, we have to look in the mirror, and that sucks. But that's the villain. That's the greatest villain. The other villains are, you know, small potatoes. That's the fucking potato farm. Sorry, I cussed. Oh my God. But like, you know, like that's what we got to do. And that's, oh, is that uncomfortable and really hard to get folks to do, particularly if they're running for office and we have our laws made by those people. So it's like, it's a really difficult place to try to find ways to change for the better. But at the very least, we got to stop doubling down on the idea that we will, you know, add coercion to make it better. That's just, we can't double down on that. We've been doubling down on that for a long time. We just cannot. That is not how it works.
Well, Harriet, I mean, what you're getting at is the concept of those no easy villains, right? It's very easy for me to blame traffickers for trafficking. It's very easy for me to blame buyers for the sale of sex. It's very easy to do, you know, to feel like I am doing everything that I need to as an anti-trafficking activist by putting a trafficker in jail. When, if we, again, bringing together those concepts of nothing about us without us, you know, survivors are saying, and we hope to expand on this in a future webinar, survivors are not necessarily saying that that's what justice looks like to them. And it is very, very easy for us to kind of paint a picture where we put a trafficker away and we've done our job. But what that does is it allows us to be silent about addressing those larger systems of oppression and inequality that foster trafficking and exploitation as a whole. It allows us to rely on a criminal legal system that is inherently flawed. It allows us to ignore police violence against people of color as a whole, some of whom may be traffickers or sex buyers. It allows us to ignore police violence against people who trade sex, against immigrants. You know, it allows a very complex issue like trafficking to be made very simple. And I don't think that we do ourselves as a movement any favors. And this is speaking from someone, you know, I've been involved in this movement, I can't believe it, close to 20 years at this point. And even I had to stop and prep for this because I didn't necessarily know how to say what I wanted to say. Because I just get swept up like everyone else in doing our work and doing our job. And I think part of harm reduction, or what I'm hearing from you, is harm reduction is addressing those institutional organizations that drive inequality as a whole, because when we address those systems, we are going to reduce the harm of trafficking in and of itself automatically.
Yeah.
Automatically is not the right word, but
consequentially, yeah.
Consequentially, like thank you. Not automatically was the wrong word. I'm sorry about that.
And I think like if we want to get at this phenomenon of coercion or kidnapping, something like that, and then forced labor, why aren't we talking to farmers, right? So much of human trafficking is for farm labor. Why aren't we talking to farmers and figuring out like, why aren't there more unions of farmers? Like, what would it look like to strengthen the sector so that the kidnapped laborer is the anomaly and not the norm, right? And so what would it look like to do that for farm work? Maybe it means we actually give farm laborers a living wage and we have healthcare and we don't expect to get paid in crack and things like that. Like, there are farms that do that in Maryland. So that kind of thing, right? Like, let's strengthen that sector so it becomes harder to coerce laborers. And the same could be true for sex work. Let's strengthen that sector, make it not a crime to engage in, and then it'll be harder to coerce laborers because they will be like, no, I've done a great job over here. Like, what's happening? You know, so strengthening those labor sectors has to be part of the thing. It's not just rescue, you know, Eastern European white girl. That's lovely,
but it's not as sexy, Harriet. It's not as sexy.
I know. Yeah.
Heather, any questions? I do want to talk with our panelists about, we have about 14, 13 more minutes. Just want to ask some questions about some policy goals for BHRC going forward, but I wanted to check in and see if there were any relevant questions or comments that we could share first.
Sure. Yeah, there's been a couple of comments just talking about asking how harm reduction could, help address the increase in sexual violence and trafficking that's happening amongst Indigenous Black and Brown people. And I think some of the discussion has been addressing that, again, looking at some of these greater systems as opposed to just going for penalization and criminalization. But I'd be happy to hear.
Was the question the increase in?
It was noting an increase. I think it's maybe perhaps more of an increased awareness.
Thank you. I was going to say there hasn't been an increase.
Yes. So, and then there were a few questions just with regards to other groups that the Baltimore Harm Reduction Coalition might be collaborating with, specifically if there's any LGBTQIA groups that are working with, if there's any volunteer opportunities. And also asking some questions around how members of the BDSM community might fit into this discussion of harm reduction, especially in terms of kind of being targeted. So those are some of the comments and questions that were coming through.
Yeah, well, and I think Owen can also help speak to this a little too, is the partners that we work with, as well as the HRC ourselves. We're a bunch of queer folks, so come work with us. We can talk about how queer we are if you want, but no, that's in jest. But no, I mean, there's a lot of, queer people will save us all. And so there's a lot of queer-led and Black trans women-led organizations in Baltimore and work around the state. So specifically around when it comes to work that is led by and for Black trans women, Baltimore Safe Haven is a pinnacle of glory in the city, and they do a lot of outreach, and they ask for volunteers to do a lot of different work often. So Baltimore Safe Haven, which the ED is Aya Damons. And so if you look at Baltimore Safe Haven, they are all over social media. And yeah, they have lots of volunteer opportunities to support their outreach work. They tend to do a lot of outreach in the middle of the night. But I know there's actually D17, December 17th is the day to end violence against sex workers. And I know that they are doing a specific what they call all hands on deck outreach event that night. So please look into Safe Haven for that. And then SWAP is a group that is sex worker led, and they, I believe, are possibly taking a break right now, but there might be some efforts if you want to support them. Again, Baltimore Harm Reduction Coalition, we do a lot of outreach and work. We're happy to talk about that. So and Power Inside, of course. I'm like, who am I missing? I don't mean to miss anybody. Power Inside, what kind of opportunities would there be to work with them right now?
Yeah, I'm not sure what volunteer opportunities they're going after right now, but you can always contact them. Really responsive over Facebook Messenger in my experience, and email and call. In the past, they've had folks assist with some of like the data entry work and putting things together and sorting. There's just often a lot of background labor for anything that needs to happen to assist somebody.
Yeah.
So yeah, who made sure that hat was clean before you handed it out? Where'd you get the hat from? I mean, it's like these little minutia things that we don't think about that I'm sure that they might need some assistance with.
Yeah.
And then we also accept volunteers. We have a lot of, because of COVID, we need to have shorter interactions. So we hand people sort of like ready-made bags that are just like, okay, there's a bunch of snacks and there's a hygiene kit and there's 2 masks. Hopefully one of them fits, we kind of like make ready to go, easy to hand out, all in one bags. And so we have a lot of need to put those together and a lot of need for people to sew masks. which is not as fun sometimes, depending on your skill set and interests, but we need a lot of mask sewers.
And we'll
Owen,
include, we've had a few questions about the organizations, and we'll send out a list
okay, great.
of the organizations that are here in the Baltimore area and in Maryland. And we'll also be sending out, people are asking to distill some practical tips. We'll be sending out a tip sheet as well. So you will get a lot of resources after this webinar.
Yeah.
I wanted to offer a brief answer to the question about relationships to BDSM and harm reduction, just being that, like, naturally, anyone who knows a bit about both should know that there's a lot of overlap in terms of like practice and safety and communication and like needs to have those things. Right now, like I'm not currently aware of direct work happening between those spaces, but that doesn't mean it's like not happening and not something I like don't have an interest in. Specifically when it comes to like sex work and drug use, like PNP is something frequently referred to. It's party and play. It's typically like having sex for an extensive period of time with the use of methamphetamine or other drugs. And so there's definitely like some really enriching conversations to have around harm reduction strategies for particularly queer people who might be engaged in those practices. I know it's a little bit more common in those circles. And so, yeah, and I say that like as a trans man who like is engaged in a lot of like a variety of experiences. And so if people do have specific questions around that, I would be happy to be like to be reached out to. My email is owen@baltimoreharmreduction.org. So yeah.
And we'll put that on the materials for sure. Yeah. All right, in the last couple of minutes that we have, I love that Heather, over the time that we've had these webinars, we were like, we're gonna go an hour. We're gonna go an hour and 15, and now we just embrace our full 90-minute selves.
Next one will be 17 hours.
like Rajani wanted. The last question, I mean, I have a million other questions, but I do want to give Baltimore Harm Reduction Coalition the floor to help the anti-trafficking community know what to look out for in terms of policy recommendations going forward. I have no idea what the Maryland General Assembly is going to look like, nor do I pretend to ever know it. But if things are typical, where you can actually bring bills and have hearings and potentially pass stuff, if that were to happen, what are some of the, maybe the top 2 or 3 proposals, legislative proposals that Baltimore Harm Reduction Coalition is getting behind or spearheading?
Great question. I will name 2 specific policies, and then I'm actually going to turn it over to Owen to help frame a bit of what our sex work, harm reduction policy work looks like right now. So as far as the 2 specific efforts, and y'all can still hear me, we're a little frozen, but I just want to make sure. Okay, cool. So overdose prevention sites, we are going to be working with legislators for the 6th year this bill will be presented. So overdose prevention sites are spaces where people can use drugs under supervision. It actually is a way to prevent overdoses. There are over 150 of these types of spaces around the world. They have been in existence for almost 30 years. And with the millions of injections and various ways people use drugs, the millions of ways people have used in these spaces, no one has ever died of an overdose. And that is the #1 thing. They save lives. And so overdose prevention sites are not yet legally operating in the United States, but we are working through the Bridges Coalition for Overdose Prevention Sites that has close to 30 organizational members across the state. There will be a bill up in the Senate and the House. Senator Shelley Hettleman and Delegate Pena Melnick are the champions. And so Senate Finance Committee and Health and Government Operations in the House.
And Rajani, just to put a plug in or a bug, I should say, in the anti-trafficking world's ears, not a plug, a bug. So the HTPP at UB actually drafted testimony in support of overdose prevention sites last session and plan to do so again. So if anyone has any questions about the intersection between overdose prevention sites and preventing human trafficking, please feel free to reach out to me. I'm happy to provide our previous testimony for you to review. But it really is crucial for anti-trafficking activists who are activated by this conversation to understand that you have to get your butt in the game around things that are not just trafficking related. And this is one of those things. And one of the bills that we particularly, or actually the students particularly selected as, oh, I think we lost somebody, that we selected as bills that we were going to support. So just want to kind of put that bug in the ear of the anti-trafficking world. Oh, they're back.
We're back.
And live with video.
Yeah. The other piece, so glad about that. OPS is really near and dear to our hearts. We would love to talk to anybody about it. And so the other piece is really we're working towards a Maryland free from criminalization, thinking of it like that. So we are in partnership with various organizations and groups who are working at different levels towards that. And so a specific bill that BHRC is working on is to decriminalize paraphernalia. And it'll be the third year in a row. I'm looking at Owen to always confirm, because I never, third year, yep. So that is a specific bill we are working on. We know we have a partner, Communities United of Maryland, who is leading an effort around decriminalization of possession in general. So, there's lots of efforts around that, but we are also very interested to move forward on efforts around decriminalization of sex work, and know that current laws that stand that would be complicated are around human trafficking, and we don't want to be, we are all in this work together. And so I'm turning it over to Owen to see if there's anything you want to add about that as far as researching that work and education around that work this year.
Yeah, thank you, Rajani. Yeah, happy to. As far as like human trafficking laws and legislation that we've like identified as like areas that as harm reductionists we'd like to see change in are like definitely SESTA FOSTA, which I'm sure like many of us have talked about a lot. This came out in 2016, I believe. Definitely is a part of the new Trump administration and has caused significant problems for sex workers who typically would have a much easier time being able to screen clients, employ their own.
And trafficking survivors.
Yeah, yeah, and as well as I think I even heard reports from law enforcement that they have now struggled, in addition to now prosecute traffickers because of the lack of websites and the inability to use those same spaces to gather information and do their work.
And tracking victims.
Yep.
As they're trafficked throughout the country.
Yeah.
And so it's pushed people to the street to find work, often as a result of not having Craigslist back pages and all of the other websites that people were previously using much more frequently. In addition to that, I mean, I could go on for a long time about the intricacies and difficulties of our state level trafficking law. I will say it's become really clear to me that there's sort of like a stalemate because it's so hard to prove coercion. And I know I'm speaking to a lot of lawyers on here, that it's tough to know really the right direction to go in. But I can say safely that having a misdemeanor human trafficking charge that doesn't require proof of force, fraud, or coercion wraps up sex workers and is like not in alignment with a harm reduction approach. While we may not have an easy solution or the right solution yet, that approach is not the right one. And we are trying to work to like find ways to talk to people like Jess and like Heather, and to talk to sex workers with lived experiences to sort of brainstorm like how we can get to a place where we can change this law so that we are not arresting and criminalizing people for living their lives and practicing sex work in a consensual and like non-coercive manner.
Yep. And I think that issue, obviously, we're not going to come to any decisions today, any recommendations today. But anyone who's heard us talk about the anti-trafficking law in Maryland, there are significant concerns about the depth and breadth and reach of the law in and of itself, and also kind of on the positive side, the fact that a law that doesn't require force, fraud, or coercion can be used to criminalize a trafficker without having to put a victim on the stand. There's a lot to be discussed, and we need prosecutors, we need defense attorneys, we need harm reductionists, we need anti-trafficking folks, we need sex workers, we need all of those people at the table, because again, nothing about any of our work without our input. And so thank you for highlighting a couple of those policy measures. The decriminalizing poverty in general work that's being done in the state of Maryland is really inspiring. And I've been privileged to be a part of that. So if anyone has questions about that, please reach out. And then from there, I think I'm going to turn it over to Heather to kind of wrap us up. And again, just understanding that I'm sure this is bringing up way more than we could ever actually talk about. But this is 101. This is the beginning of the conversation. And we look forward to seeing where this type of conversation goes.
Yeah, thank you so much to our presenters. This was an incredibly engaging discussion. And, you know, I've been a little quieter because I've been monitoring the questions and the comments and trying to respond to people. And there are so many exciting connections that are going to come out of this presentation. So again, thank you so much for your input and for just, yeah, giving us so much to think about and to apply, you know, for the many anti-trafficking agencies here to apply directly to their work going forward. So I've put up some resources on this slide and ways to get in touch with our colleagues and to learn more about some of the different programs that were discussed, the Bridges Coalition, the Maryland statewide network. But we will also be sending this information out to you after the webinar. So a huge thank you again. We just have a few more quick housekeeping slides and then we'll be ending things. But we really appreciated having you here today. All right, so here's information for Jess and myself. Again, we will be sending this out as well. If you need to reach out and are interested in learning more about services through the Human Trafficking Prevention Project, I also want to note too that we do have a new website and outreach materials that are available. All of our past webinars, and including this webinar should be up by the end of the week, are available at www.mvlslaw.org/HT. You can go there to learn more about our program and services. If you are a individual who might be in need of free civil legal help or help with criminal record relief, you can fill out a form, make a referral easily on our website, get information about what we do. If you are an attorney and you would like to volunteer to assist with the program, we are always looking for new volunteers. Please feel free to reach out as well. And if you're interested in getting some of our outreach materials, you can feel free to email me directly. My email is right here. And these are just some examples of some new outreach materials that we've developed in consultation with survivors, with advocates, with the community that we work within, to get the discussion going about whether someone might be able to access criminal record relief and other civil legal assistance through Maryland Volunteer Lawyer Service or the University of Baltimore, which are partners with the HTPP program. We're going to send out a quick survey after the webinar. Please tell us what you think, and thanks for all of the incredible feedback throughout the presentation. MVLS does continue to be open and accepting new cases through our online intake or through our phone intake lines. You know, again, if I'd encourage you to reach out to me directly or go to our HTPP website, but we also have general legal services available, and we are still operating and accepting new clients despite the coronavirus restrictions that are in place. For those of you who might be interested in some of our upcoming trainings, now these are a little bit more geared towards volunteer attorneys that are working with MVLS or here in Maryland, but you can always check out what's coming up on our calendar. We have some interesting discussions coming up around some of the red flags that you might need to watch out for with what's all going on with utilities, some of the moratoriums on billing, and consumer protection laws. We also have a wonderful program that is focused on assisting older adults and talking about financial stability, and there are some webinar presentations coming up related to those programs. But you can check all of this out at our MVLS website. MVLS also is, like I said, always recruiting new volunteer attorneys to help with cases throughout the state of Maryland. If you're interested in taking a case, you can visit our website or go to our pro bono portal. If you're not a volunteer yet and you are an attorney and are interested in helping here in Maryland, we'd love to have you sign up for our panel, and you can visit our website today. So again, thank you so much to our presenters, and we are so excited to have such a robust audience during this presentation and discussion, and we look forward to hopefully having you join us for upcoming webinars. We try to hold them quarterly, and we'll be sending out notice of our next one soon. Thank you so much.
Thank you.
Bye-bye.
Thank you. Bye.
Thank you so much, BHRC.
Thank you, Jess. We'll be in touch.